A short walk through Melbourne's inner city streets reveals the city is grappling with a very graphic problem.
When you get down to public drug consumption, public intoxication with illicit drugs, you're mostly talking about the most hardcore cases in terms of drug problems. And so you end up with a cohort that's incredibly mentally health challenged. They've often got extreme trauma experiences in their past.
For all of the issues around drug use in the state, leading public health researcher John Ryan says the Victorian government's approach isn't working.
My observation is that we're not doing nearly enough to get people into the care that they need. It's one thing to have supervised consumption so that people aren't overdosing, but then the question is, what do we do with those people and how can we actually help them? Leaving them to their own devices is not enough because they're obviously in crisis situation.
So it's well known that Victoria's kind of drug of choice in the illicit market is heroin, more so than New South Wales. And yet in Victoria we have about 7,000 or 8,000 less people in treatment than in New South Wales.
Dating back to the 1990s, Melbourne has been seen as a hotspot for drug use, particularly the opioid heroin. And according to John Ryan, it hasn't really gone away.
Heroin is one of the drugs of significant concern, and it tends to be concentrated in public settings like the area that we're in now. Our heroin problem, according to, for example, the wastewater analysis, shows that we've got one of the worst, if not the worst, in Australia.
Victoria's plan to help those who are dependent on drugs includes the North Richmond Injecting Centre. The government has plans to build another one in the CBD. John Ryan has long advocated for what he says is the most important part of the solution, the wider accessibility of opioid replacements like methadone.
It's actually quite difficult to get onto opioid substitution treatment in Victoria. Potential patients find it very difficult to find a doctor. The doctors that are doing it are incredibly busy and not necessarily able to provide the holistic care that those patients need.
The next stop is Hodgson Street.
James spent about a decade addicted to drugs, including heroin.
It was just a thing, like I guess at work, I had a friend that was using and it became a sort of daily thing. In our lunch break we'd go and score, and it sort of became a bit problematic because it was associated with work. So every day I'd go to work and then I'd meet someone at work and we'd sort of, it was like a codependent relationship.
He heard about methadone treatment through friends.
I knew it was a treatment option and I kind of thought, I think it might be beneficial, but at the same time I didn't have much hope for it.
The treatment worked and he hasn't touched heroin in about 7 years.
You take your methadone, it sort of stops the cravings, like it stops you going from physical withdrawal, and you can sort of go to the pharmacy, take your methadone, and then, just go on with your day. It simplified, for me personally, it simplified things.
For people to receive methadone treatment in Victoria, they need to have it prescribed by a doctor or a highly qualified nurse practitioner. James visits his GP, Paul McCartney, about once a week to pick up a prescription and talk through any health issues.
Are you happy on doses at the moment? Or?
Yeah, everything's good the way it is. Yes, I recently, there was a dose range that I could sort of go up and down with, and I've sort of gone to the max of that.
Statistically, James is one of the lucky ones. His doctor, Paul McCartney, who's a GP as well as an addiction medical specialist, says very few medical practices offer opioid replacement or methadone treatment for drug-dependent patients.
Every GP clinic in Victoria is allowed to prescribe up to 5 people with buprenorphine treatment for opioid dependence. The number of GP practices that do prescribe is very low.
Why do you think it's gotten to this point?
There's a perception that these people are going to be hard, complex, and GPs are busy enough. They're seeing enough people, their books are already full, if you like. So there will be people left, people suffering, and we know that when people who are on opioid treatments are either forced to wean or unable to get their access to medication, they're at really high risk of overdose and of things like suicide and self-harm.
The Victorian government has recently committed $10 million to better opioid treatment in the state. But those in the industry believe much more money is needed to incentivise medical practices to treat addicts. In New South Wales, heroin treatment is available in various state-funded clinics, and Dr McCartney says Victoria is well behind other states.
There are some hospitals that are providing a service, but my understanding is that they don't really receive adequate funding.
A spokesperson for the Victorian Health Minister told 7:30 that the government spent $370 million on drug and alcohol services this year, and of that, $10 million has gone towards covering the gaps in the system that deal with drug replacement therapy, a service it says should be covered by Medicare and the federal government.
We've got a massive gap in terms of capacity in the Victorian system compared to the New South Wales system, and interestingly, New South Wales, if you remember in the 90s, was very much a heroin capital of Australia, but they've really treated their way out of the problem. We haven't taken the same approach in Victoria.
His concern now is that an influx of another opioid drug, fentanyl, a substance wreaking havoc in the United States, could take hold in Melbourne due to the lacklustre treatment options available to addicts.
We've often followed the American market, but not always. We've never had a crack problem in Australia. They had a huge crack problem in the US, so we might not get a fentanyl problem, but it's a 50-50 in my view. But the scale of the disaster that fentanyl would create in Australia means that we should actually be acting as if fentanyl is inevitable, because prevention is much better than cure.
There'll eventually be a flood, and the flood will be with fentanyl, much more dangerous than heroin, with, unfortunately, we expect, hundreds, if not thousands, of overdoses. That's the thing we're most terrified about.
James says he's slowly weaning himself off methadone, and he's finally free of the chaos drugs caused.
My outlook on life was pretty grim. Like I didn't plan too far into the future. I wasn't a happy person.
You happy now?
I've got everything that I want. Like I have a partner that I love, and she loves me, and that was all I really ever wanted, and I didn't think it was a reality. And yeah, so, and also I think my family, they don't worry about me anymore, and that means a lot for me.